Welcome to Medical Monday.
Welcome to Medical Monday.
Yeah, it's national underground thunderbound when I stop the ground like a million elephants, a silverback orangutan. You can't stop a train. Who wants some? Don't come unprepared. I'll be there. But when
Hold on 1 second. Come in. Hey, Brendan, Dale, how's it going, guys? Have a seat. Listen, we got to talk about a call.
What is this? What's happening?
So, you guys had a call the other day, and you intubated a patient, and things went pretty good. The tube was good, but then things sort of started going bad. Your patient got real hypotensive, started to desaturate, and sort of crashed and burned.
Is it our fault? Is it because we were bad?
Well, look, I mean, it's not about whose fault it is. You know, it's just...
Whose fault is it? Oh!
Guys, again, it's really not about... I think maybe there's something to learn from it. There's actually a pretty good mnemonic for...
I'm going to throw up. I think I'm the nice dinner that I had. I'm going to throw it up.
Look, I think what we need to do is talk to Dr. Marchetti. He's our EMS fellow from UT Southwestern. You've probably seen him around a little bit, but he's got a really good mnemonic and a really good approach to dealing with an intubation that starts to go bad. So let's talk to him.
Hey, Dale and Brennan, come on in. I heard some crying next door. Is everything okay?
What can we do to fix it?
Okay, all right, yeah, so I hadn't had the pleasure of meeting you gentlemen yet. So my name is Dr. Brandon Marchetti. I'm a ER doc out at UT Southwestern in Dallas, and I'm currently here with Dr. V and Dr. Richmond doing my medical director FTOs. I wanted to talk to you guys about something called the D.O.P.E mnemonic, D.O.P.E. No, not that kind of dope.
It's just two dope boys in a Cadillac.
No, not that kind of dope either. Guys, it sounds like you had a real sick COPD patient that you ended up having to intubate. And I don't know if you've ever had this before, but if you've ever intubated a COPD or asthmatic patient and things went really well at the beginning and then they didn't, we can use this mnemonic to give you guys a structured way to go through how to troubleshoot the tube. So there's 4 things to remember in the D.O.P.E mnemonic: D, O, P, and E. First up, the D stands for dislodged tube. The ET tube or the King airway, it can come out for a ton of reasons. The patient gets transferred, the tube becomes dislodged. Chest compressions, the tube becomes dislodged. Bagging the patient and pulling on the bag or pushing on the bag, the tube can become dislodged. Most medics, they tend to just manipulate the tube back and forth and push it and pull it and you know, play with the cuff, and sometimes it works, sometimes it doesn't. Meanwhile, your patient's still suffocating because you're not appropriately ventilating or oxygenating them. So that's the D. Next up is the O. That stands for obstruction. Usually that happens if you get a blockage in your tube. It can be mucus, it can be vomit, it can be blood. That one you just simply suction out the tube. You can do some deep suctioning on it. Go down into the past the cords, past the cuff of the tube, down into the trachea. See if you get out any clots or anything. That doesn't mean it's not going to come back, but it's something you can try. If they get much better after that, then that was the answer. The P stands for pneumothorax. Not just any pneumothorax, but these are usually the tension pneumothorax. Since they had COPD, they already have diseased lungs anyway, and if they go from breathing with a negative pressure, pulling air in, and you're breathing with positive pressure on a bag, you can easily rupture those bloods, and as you keep bagging, it builds into a tension pneumothorax. You'll see their pulse ox start to drop, their end-tidal waveforms will be pretty crappy. Then late stages, their blood pressure will start to drop. That's because they're going into a tension physiology. At that point, the only solution is to dart the chest, do a needle decompression on the side that's under tension. And then the E stands for equipment. You intubate your patient, you're bagging your patient, and the first thing you want to do is make sure that everything's connected like it's supposed to be. And if things are connected, then you don't really have much other way to troubleshoot your equipment. Sometimes they put an S at the end of this mnemonic for D.O.P.E.S, and that stands for
Slithery little sneaky snake.
No, and that stands for stacked breaths. Now you usually only see this in your asthmatics or COPD patients because they have an obstructive respiratory pattern, and if you notice, if you watch them breathe, they don't have a problem breathing in, they have a problem breathing out. You have a hypoxic patient, asthmatic let's say, and you put the tube in, everything goes well, and you're bagging, and you know you're trying to get their pulse ox up, so you're hitting them once every 3 or 4 seconds because you're just over anxious. And next thing you know, it's getting harder and harder to push that breath in, and their pulse ox is looking crappy. In that case, you need to recognize that you probably are stacking these breaths. They don't get one all the way out before you give them another one. And in that case, take the bag off, give them a good old-fashioned bear hug, get all that air out of them, and then reattach your bag, and it should be much easier to breathe for them in that case. So, next time you intubate a patient and you see them going downhill, just remember the D.O.P.E.S mnemonic and go through it like a checklist when your intubated patient is crashing on you. Sound good?
Yup!
She grew up in an Indiana town, had a good-looking mama who never was around, but she grew up tall and she grew up right with them Indiana boys on an Indiana night.